every organization has a completely different level of digital maturity. So you've got people in London who've got HIMSS level 7 digital maturity assessment, and then you've got other trusts without even a proper electronic patient record, and for various reasons this has happened, hasn't it? Just down to digital strategies, funding, just sometimes good luck for that organization. So it's a real patchwork of digital maturity at the moment. I think in Leeds we're somewhere in the middle. So we've got our own bespoke electronic patient record, which we've developed over the last kind of 20 years in Leeds, and we're making great progress. But we're probably not as far advanced as the other organisations, but we're kind of far better off than many others as well. So I guess there's a couple of things, isn't there? So it's all down to guaranteed funding, or at least a surety of funding. So the problem with the NHS funding, it's on a year-to-year basis, so it's really hard to plan. And there's probably a number of trusts out there who are waiting funding decisions so they can decide whether they can invest into a new electronic patient record. But it's always kind of left to the last minute, and a lot of information about recruitment of staff or investment infrastructure is always difficult to plan ahead. So I know in Leeds we've got a kind of 5 to 10 year strategy of the kind of investments we need to bring our infrastructure and end user compute up to a certain degree of maturity, and on all of our software systems. But we know there's going to be an amount of money, but we've got kind of this gap of funding which will determine kind of how far we're going to get over the next 5 to 10 years. If we don't get the funding, we'll have to cut our cloth accordingly. In some ways, we're quite fortunate that Leeds is quite a digital city. So there's quite a lot of workforce around and quite highly skilled individuals. But the downside to us is they can go off and work for organisations like Sky Bet and or they can work for contractors and earn a lot more money. And it's very difficult to employ them in the NHS under Agenda for Change pay grades. So there's a real challenge about getting the right workforce with the right skills in place. Other areas are going to have different challenges. They might not have availability. So if you live in a really rural place, then it may not be a centre for IT professionals to live and work in. And if you work in a place like London, there's again a massive demand for those individuals. I guess with remote working, then it kind of has helped a little bit because people can work anywhere in the country, can't they? So that is probably one benefit of COVID, that remote working's kind of increase that fluidity of professionals to work where they want to. One thing that most trusts are lucky for is a lot of their workforce are really engaged with improving patient care, and they're really interested in using digital technologies to help achieve that. And we've seen that ourselves in our own organisation, that we're kind of overwhelmed with requests for projects from our staff members to kind of use the latest digital technologies. Unfortunately, there's always too much to be done, so we have to balance what kind of innovations and technologies that people want to use with our resources available. So our main key focus is kind of at least getting the basics right, and then looking for what those extra kind of those next things we can be doing to deliver benefits. It's like the adoption scale, isn't it? So you've got the kind of innovators and early adopters, and then the laggards at the back. So it is a real difficult challenge. I know in Leeds we're relaunching our digital engagement strategy. We've got a new Chief Clinical Information Officer, Sarah Hambridge, who's come across from the Christie in Manchester, who's bringing some fresh ideas in and relaunching our digital engagement. And a lot of that focus is going to be on staff training and education, because we can probably make a massive difference for increasing the level of the people who've maybe got the least digital skills, and that can make a massive transformation for delivering patient care, rather than spending a lot of time on kind of upskill people who've got a reasonable amount of digital skills. I mean, there are lots of opportunities around. There's kind of online courses you can do. We've got our own in-house training team. We've got people who work on the shop floor. So we've got a digital implementation team. We've got digital clinical nurses who can deliver that face-to-face training. So got multiple channels for delivering education. But I think generally you find that most people want to learn new skills, new technologies. It's just along their busy day jobs, it's sometimes a challenge for them to have the time to kind of learn these new skills along with delivering patient care. Additionally, it could have been described, I'm sure other trusts had the same experience, a bit of a Wild West. So digital systems have been brought in without sometimes great governance about who's going to take ownership of them. So one of the things we're now bringing in place is a proper project process. So anybody who wants to bring new digital systems into the trust has to go through an expression of interest. We review them as CCIOs and a digital team, just so we can work out kind of, is it going to add benefit to the trust? How much it's going to cost? Because people often will be informed by a digital software company that this new technology isn't that expensive. But when you bring in the total cost of ownership around licensing fees, infrastructure, training, it's often underestimated. So we've got this really strict process all the way from project initiation now to project delivery, so just to make sure we've got proper governance behind it, to make sure that we can get benefits from the new technology being brought in, make sure we spend our healthcare pounds in the best way we can. I'm come to listen as well, and to understand the views, because I think I'm on a panel with some of the national teams, so it'd be interesting to hear their views. There's been a lot of talk about EHR convergence, which some may see that as a threat to some organisations, a bit like us in Leeds, where we've got our own bespoke electronic patient record. And even in our region, we've got 3 or 4 different suppliers of electronic patient records. But I think we can back up what we do in Leeds, because we've got a really good history of sharing data across the region. So with the Leeds Care Record, now the emerging Yorkshire Umber Care Record, we can show that despite we're using different applications across the region, we've got a really good basis for sharing information. And that's the most important thing, is actually, as a clinician, can you get the right information in your hands when you're making those kind of tricky decisions about patient care?